I think not all of us in this room will be doing cochlear implant. So what the next question perhaps when she's giving lecture is a checklist of all possible investigations that you have to do when you get a patient in front of you. Because then you can gather these patients and they can then go to a particular center of your choice. Maybe, you know, to one of the hospitals within Kolkata. But at least we all should be able to do a series of investigations so that the patient can be, you know, counseled, because all of us should be counseling these patients. You want, okay. See, we all ENT surgeons, whether we do cochlear implants or not, we all should be counseling for cochlear implants. So what we need to know is from these doctors, what are the list of investigations that we need to do? And we then counsel the patients and then send it to various centers within Kolkata so that the surgeons then can carry forward. Why not all of us be doing this? Because one thing is expensive, it needs a lot of expertise, and there should be few centers who do large numbers. Only when you are doing large numbers will you get a lot of confidence.
This is a milestone operation.
Yeah, I think you will tell about CT scans and MRIs. It's a very, very important investigation should be done before doing this surgery. The thing is, that also costs a lot, about 10,000–15,000 rupees for MRI and CT scans. But still, you will have to go for that, because in one of our cases, postlingual cases, when we opened the middle ear, we did not find the round window. And it was a very difficult job, and we tried in several places to open the vestibule and put the implant, but we couldn't do that. Naturally, we had to come out and closing the operation and convince the patient that this is the situation and we will have to go for searching in another ear, in other ear. So the party was very good and they agreed upon, and after 7 days we opened the other ear, and in that year we got the round window. So while you go for CT scan, you should give this information to the radiologist that give us regarding measurement of the round windows and oval windows and all this. And other thing already you will have to see for, that is patency of the cochlea. So all these things are very, very important, and position of the facial nerve and position of the all the 4 nerves in the internal auditory canal. So that will have to be seen by the MRI. So unless you do MRI also, only CT scan will not suffice. So as regards radiology is concerned, this MRI and CT scan both should be done. Must be done, I should say, if you go for cochlear implantation. And other thing what happened, Dr. Amit will definitely say about that, where we'll put the drill to do for cochleostomy. And in the book, if you read that, it should be done in anterior-inferior part of the round window. But my experience is very little, of course, but what my experience goes, it should be more of anterior rather than inferior. If you go to the inferior, you might go in most of the time into the cell hypotympanic cells. In one of my cases, it happened. So it went to hypotympanum and hypotympanic cells, and the patient was not improving, and that patient was opened again and put the implant in the scala tympani. So these things will have to be considered, and one becomes more experienced and come across all these difficulties, and only then he can learn fully to do cochlear implant surgery. So these things should be kept in mind. And vaccination. In all cases, especially in children, at least 1 month before the surgery, you must go for vaccination for these Haemophilus influenzae, meningococcus and pneumococcus. So we do in all our cases. So that is the thing. And the more you come across regarding the surgery and where is the facial nerve, where is the chordae tympani, all these things should be considered And one can gather this information unless he does it. Only by seeing it cannot. You go for the cadaver dissection, or you go for the surgery under the supervision of an experienced surgeon, and stage by stage you go for surgery, and only then you can learn this art of doing cochlear implant surgery. That much.
More any comments? Hello.
Sir, how long before the surgery do you have the vaccination done?
1 month before.
1 month.
At least 1 month before.
At least 1 month.
Yeah,
so
yeah.
you stick to that as
Yes.
standard.
Any comments on your package? You all also do a lot of investigations.
Yes, I mean, we do as a routine, I mean, whenever there's a deaf child, what we do is we first have the autoacoustic emissions done. I mean, if the child is, below 2 or 3 or 4 years, where pure tone audiometry is probably not as reliable. So we have an autoacoustic emission done, possibly a play audiometry and a BERA, and then an ASSR. So this is the minimum that we do as and a tympanometry obviously for audiological investigations, and then comes the rest of the investigations. So this is the bare minimum that we have done.
What is your package price?
We don't do ASSR in our hospital yet, but I think the prices have just been revised. But autoacoustic emissions, BERA and tympanometry, that would come to somewhere around, I would think about 2,000. Yeah.
You don't go for ECOG?
Not as a matter of fact.
Why? Then how do you know that the population of spinal ganglion cells? If you do not know, you are putting so costly a machine and purchasing by the party, and you do not know how many cells are there are surviving. If you put the implant and no surviving spinal ganglion cells are there, so what would be use of doing the cochlear implantation? You must see that cochlear ECOG must be done in all cases. ECOG is very, very important.
Mandatory.
Yeah, to know the population of the spinal ganglion cells. Yeah.
Procedure